Maybe you were told a really funny joke. I mean, super funny. And you started to laugh, and then you realized that you leaked a little bit. That's right, you leaked a little bit of urine. Or maybe it's not with laughing with you. Maybe it's coughing or sneezing or exercising or lifting heavy things. When you do those activities, you might leak urine with those. Or maybe that's not the issue for you. Maybe it's something entirely different where once you get the urge to go, like the urge to urinate, you've realized that if you're not in the bathroom like lickety split, you may be at risk of leaking urine then. Guys, we're talking about urinary incontinence or bladder leakage. This is such an important topic and it affects both men and women, so men, don't turn off this channel. Guys, I'm going to give you some treatments, some really effective treatments for bladder leakage. But first of all, you should know millions of Americans are affected with this, and it's a big deal. It can be embarrassing. Many of my patients are so embarrassed by this, or they limit their activities, meaning they don't do the things they'd like to do. Maybe they're reluctant to go to the movies or be stuck out where they can't find a bathroom or access a bathroom very quickly. It can also cause problems with intimacy or sexual function, wanting to be intimate, all of those things. And also, there's some medical things, right? It can cause skin rashes. There are other things that bladder leakage can cause. This is a big deal. It's not a small thing. So if this has been happening to you, first of all, if you feel so inclined, please write in the comments, by the way, because one thing I've learned by doing these videos and talking with you guys about different topics is when you write about your experiences in the comments, it ultimately sort of gives permission for other people to do the same, and it lets others know that they're not alone. So feel free to chime in if this is you. But anyway, so first of all, you should know that bladder leakage or urinary incontinence does happen in both men and women, though yes, it is more common in women at certain times in a woman's life, during pregnancy, after childbirth, also in women over the age of 50, sort of in the menopausal age. Those are particular categories. But yes, it happens in men too. And the thing about it is when we talk about bladder leakage or urinary incontinence is that for some people, it could be just like a little dribble. But for some people, it could be a lot of urine to the point where it really, really is disruptive. You are changing your undies. You're bringing extra pairs of undies. You're wearing pads. You're wearing pull-ups. You've got things stashed in different places around your home, in your car, etc., to try to make sure that you have what you need. First of all, I should say you should never suffer in silence. This is really important. Okay, I know this can be embarrassing or a hard topic to talk about, or you may feel alone. First of all, you're not. Please talk about this with your doctor because, again, millions suffer with urinary incontinence, and fixing it can really change and improve your life. Okay, there are 4 different types of urinary incontinence that we often think about, 4 different buckets. The first is urge incontinence. It's just like it sounds. The minute you get the urge, bam, you got to be in the bathroom. Otherwise, you might leak. So you get the urge and all of a sudden you got to go. That urge is very compelling. Okay. The other is stress incontinence. That's also as it sounds. When there's a stressor sort of placed with your pelvic muscles, that's when you leak a little bit. So if you cough, you sneeze, anything that sort of kind of increases that intra-abdominal pressure, puts stress on your pelvic muscles, exercise, lifting heavy things, and you leak with those activities, that can be an example of stress incontinence. Now, many times people have a combination of more than one type of incontinence or bladder leakage, okay? Keep that in mind. There's functional incontinence. That means you leak because you physically can't get to the bathroom. Maybe you have a physical impairment. Maybe you have severe arthritis that prevents you from getting there. Maybe there are other reasons, okay? But you simply can't get to the bathroom and therefore you leak as well. And then we have overflow incontinence. That's this idea that the bladder does not empty properly on its own, so it fills up, it overfills with urine, which actually causes the urine to overflow and then leak out. And that can be due to a number of underlying causes. There are specific causes that can cause each of these types of urinary incontinence. But suffice it to say, let's go to treatments, okay? The treatment that works for your urinary incontinence largely depends on the type of urinary incontinence or bladder leakage that you have, which is why you have to see your doctor, right? You also need to rule out underlying causes because some people leak urine because they have a urinary tract infection or there's something else going on, some underlying medical condition that we need to know about, okay? So always, always, always see your doctor because which of these treatments works for you depends on the type of bladder leakage you have. But things that may work, okay? Number 1 is bladder training. Yeah, it's really kind of interesting, this idea of training your bladder. Oftentimes this can work for stress or urge or mixed incontinence. There's a number of things you can do when it comes to bladder training. One of them is recording your urinary patterns, not only for you, but also for your doctor. Another thing that you can do is use the bathroom on a time schedule. We call that timed voiding, and your doctor can give you more guidance about maybe how you should do this or approach this and if this would work for you. Another thing that's a part of bladder training is this idea of lengthening the time between urination so that you can help train your bladder to deal with and hold urine more effectively. Okay, so those are things that fall under the bladder training category, and that can be really helpful for a number of different types of urinary incontinence or bladder leakage. There's also pelvic muscle rehab. What you're probably wondering, what do the pelvic muscles have to do with it? Well, pelvic muscles really are key. They are totally clutch when it comes to urination and helping us urinate and things like that. So oftentimes for people, one of the reasons why they have problems with bladder leakage is because their pelvic muscles are not where they need to be. There are other reasons as well, but that's one of them. So Caudle muscles, and men and women can do this. This idea of like sort of squeezing down there can help strengthen those pelvic muscles. We call those Caudle exercises. Your doctor can certainly give you more guidance about that. But there are other things. There's pelvic physical therapy. There's biofeedback, vaginal weight training, and pelvic floor electrical stimulation. Really interesting treatments. There's other things too. Simpler things. Avoid irritants or things that can make your bladder leakage worse. That can be caffeine, that can be alcohol, that can be citrus foods or juices for you, depending on who you are. Also, well, we have medications that treat certain types of bladder leakage. There is devices such as pessaries for some people. Some people need to get Botox injections, and some people require surgery. So suffice it to say, there's a lot of different options when it comes to treating bladder leakage. The question is what type of bladder leakage you have and which ones will work for you. This is where your doctor comes into play, and also these are some ideas you can kind of start looking into and perhaps even trying on your own as you're waiting to see your doctor. Guys, I hope this is helpful. I have more videos on bladder leakage covering different aspects more in depth. Let me know what you think. Let me know what your questions are. Let me know what your experience has been, because what you write often helps other people. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. For those of you on Facebook, please like and follow my page. For those of you who send stars, I love you all, and thank you so much in advance. I'll respond to you personally. Also, consider joining my subscription groups on Facebook, also on YouTube. On YouTube, please subscribe to my channel. Click the little bell for updates, guys. I'm Dr. Jen. I'll see you soon.